Good evening, everyone, and welcome to today's live presentation. Today, I am going to speak about ImmuLIT treatment, what the latest research tells us. I am Dr. Mohan Raut, a gynecologist and clinical reproductive immunologist certified by the American Society for Reproductive Immunology. We have our centers, Dr. Raut Centers for Reproductive Immunology in Mumbai and in many other places in India. At these centers, we treat couples with repeated miscarriages, recurrent IVF failures, and unexplained infertility with our patented and branded process of ImmuLIT treatment. If you have ever worked with couples who are struggling to conceive, or if you have walked that path yourself, you know that few things are as heartbreaking as unexplained infertility, recurrent miscarriages, or repeated IVF failures. For decades, the standard response was simply to try again, to assume it was a numbers game. But what happens when the embryos are healthy, the uterus is structurally perfect, and yet pregnancy after pregnancy fails to hold or fails to continue? Today, we are looking at the frontier of reproductive medicine to answer this same question. Specifically, we are diving deep into reproductive immunology and a major breakthrough in active immunomodulation, that is, the patented ImmuLIT treatment. Over the next 10 minutes or so, we are going to explore the science, the latest clinical data, and how this refined therapy is changing the landscape for couples who had almost given up hope. So let's begin. To understand why ImmuLIT works, we first have to understand the biological paradox of pregnancy. Very important. An embryo is a genetic hybrid. It carries 50% of its DNA from the mother and 50% from the father. You know that. So, scientifically speaking, to the maternal immune system, the embryo is essentially a foreign tissue graft. Under normal circumstances, the immune system is programmed to attack and destroy foreign invaders. So, why doesn't a mother's body reject her pregnancy? A basic question. In a successful pregnancy, the maternal immune system undergoes a remarkable shift or change. Instead of attacking, it recognizes the paternal antigens and actually it creates what we call blocking antibodies. Think of these blocking antibodies as a protective invisible shield that wraps around the embryo, telling the maternal immune cells, especially the natural killer cells or NK cells, to stand down and allow implantation. However, in some couples, this protective recognition never happens. The mother's immune system remains on high alert, treating the paternal antigens as a threat. The result is the embryo is rejected, leading to what we clinically classify as alloimmune miscarriage or alloimmune recurrent implantation failure. Now, let us see the role of active immunomodulation in this situation. This is where immunization with lymphocytes comes into play. It was introduced back in the 1980s, and it is a process where we take lymphocytes from a male partner or even sometimes a donor and introduce them into the female partner's skin. This acts almost like a vaccine. It safely exposes the mother's immune system to allogenic lymphocytes in a controlled way, educating her immune system and immune cells and prompting them to finally generate those crucial blocking antibodies. Historically, standard immunization with lymphocytes has shown promise, but its results were often inconsistent. The efficacy of traditional immunization heavily depended on certain parameters like viability, purity, concentration of the cells. The inconsistent preparations led to inconsistent results. And that brings us to the core of our presentation today, and that is the ImmuLIT procedure. Now, what makes this ImmuLIT procedure different from other standard procedures? ImmuLIT is not just standard immunization using lymphocytes. It is an advanced, patented, and highly standardized version which is developed by clinical reproductive immunologists. It is by Dr. Mohan Raut and Dr. Mugdha Raut. The regular immunization with lymphocytes can vary widely from clinic to clinic. However, ImmuLIT uses a rigorously controlled, sterile, and optimized preparation process. Let's look at the key differences that the latest research highlights. Firstly, purity and viability. ImmuLIT utilizes advanced layering techniques to extract a highly concentrated ultra pure suspension of active lymphocytes. Secondly, duration of action. Clinical observations have shown that immunomodulatory effect of ImmuLIT is much longer lasting than conventional treatments. This gives couples a wider, more stable window to achieve conception naturally or proceed with IVF. And the third is safety, because because of its highly standardized preparation protocol. ImmuLIT minimizes local tissue reaction. ImmuLIT eliminates the use of multiple doses that are given with older methods. So, what does the latest clinical data tell us? Let's come to that. Let's talk numbers, because in medicine, data is the main thing which is important. So, recent clinical tracking and data from Dr. Raut's Center for Reproductive Immunology reveals an outstanding success rate in carefully screened, highly selected patients experiencing recurrent IVF failures or unexplained pregnancy loss. ImmuLIT has been associated with a successful pregnancy rate of approximately 80%. That is our recent analysis. And let me tell you, we do not give fertility treatment or do IVF for these patients. This is the data shared by doctors who have referred the patients for ImmuLIT procedure. And now compare that to the repetitive cycle of unguided IVF attempts. In these cases, what happens is the success rate for patients with underlying untreated reproductive immune causes can be really very low. But I must emphasize two words here: careful selection. ImmuLIT is not a magic wand, and it is not for every fertility struggle. The latest research teaches us that success is entirely dependent on precise patient profiling. Before a couple is approved for ImmuLIT treatment, they must undergo highly specific diagnostic testing. This includes evaluating natural killer cells, measuring TNF alpha cytokine levels, and conducting tests to verify a lack of protective blocking antibodies. When we rule out anatomical issues, when we ensure we are working with chromosomally normal embryos and confirm an immunological mismatch, that is where ImmuLIT shines the brightest, giving us these excellent results. So, what is the step-by-step experience of the patient for during this procedure? Because for patients, the fear of unknown can be really a massive barrier. So let me simplify what the ImmuLIT procedure actually looks like step by step. It is a streamlined single-day daycare procedure. The first step is blood collection. The male partner or the donor provides the required blood sample. Second step is the laboratory processing, the most important. This is where the magic happens. Under strict lab conditions, the lymphocytes are isolated, purified, and concentrated. The step 3, this is administration of cells. The refined lymphocytes are gently injected intradermally just under the surface of the skin into the female partner's forearm. Step 4 is the evaluation. The patient returns home the same day. Over the next 4 to 8 weeks, her body begins to generate those vital blocking antibodies. And step 5 is the post-treatment protocol of immunomodulatory medications, which is an individualized protocol. And for those wondering about the discomfort during the procedure, because these are intradermal injections, let me tell you, the vast majority of patients report only mild temporary itching or a small local reaction at the injection site, which naturally fades within a week or two. So, looking at the future of reproductive care, what do we find? As we look at the modern fertility treatments, we are seeing a massive paradigm shift from regular to immunology. We are moving away from a one size fits all approach and we are stepping into the era of highly personalized reproductive medicine. And the latest research on ImmuLIT, it proves that we cannot afford to ignore the maternal immune system. By bridging the gap between the immunology and reproductive endocrinology, we are no longer just forcing implantation to happen. Let me tell you, we are actively preparing the body's natural ecosystem to accept and protect new life. So, for couples who have faced silent grief of repeated losses, Immulit represents more than just a clinical protocol. It represents a highly targeted, scientifically validated path forward, turning a history of failure into a future of success and highly successful pregnancies. So, the clinical takeaways from today's discussion are first, there is the immune paradigm. Successful pregnancy requires maternal immune system to produce blocking antibodies that protect the embryo. Lacking these antibodies triggers maternal immune rejection, leading to recurrent miscarriages or IVF failures. Second, the ImmuLIT advantage. Unlike traditional highly variable immunization with lymphocytes, ImmuLIT is a patented standardized protocol. Its precise cell purification process ensures optimal lymphocyte viability, fewer local side effects, and long lasting therapeutic window for treatment. The third takeaway is ImmuLIT is for highly targeted candidates. That is not a universal fix. It is strictly indicated for couples with proven alloimmune mismatches confirmed by the NK cells or the cytokine imbalance or lack of protective antibodies after structural and genetic issues are also ruled out. The fourth takeaway is exceptional clinical efficacy because when coupled with strict patient selection, Immulit achieves a successful pregnancy rate of up to 75 to 80% in patients who previously faced unexplained reproductive failures. And fifth takeaway is it is streamlined and it is safe. It is a low risk single day outpatient procedure with minimal side effects, typically limited to redness of the skin or little bit itching, making it easily tolerated by the patients. So, friends, this is what is Immulit and its uniqueness and the specific features of this immunological treatment. So, this treatment, as I said, is available at our centers, Dr. Raut's Center for Reproductive Immunology, which are in different parts of India. You can connect with us if you have any queries or any questions. You can connect us with us on 9833201522 or 98201 83757 or 98208 94047. You can also visit our website www.icprm.in. So, before I close my presentation, let's look at some of the questions that have come up. Just a minute. You have mentioned Immulit is safe. What are the possible side effects? Does it affect the immune system of the mother? As I mentioned briefly here, that Immulit is a safe procedure. Now, what I mean by safe, because it's an immunological procedure, the most important thing is ImmuLIT doesn't act on the immune system to suppress it. So there is no immunosuppression because because you are aware that immune system has two parts: the inflammatory part or anti-inflammatory part, or destructive part or protective and protective part. So the immunity does not act on the inflammatory part or the immunity of the patient. It strengthens the protection by increasing the protective antibodies or protective cells. So the immunity doesn't go down. It doesn't cause severe allergic reactions. There is no increased incidence of immunological problems like autoimmunity or graft versus host disease. And there are studies which have confirmed this, where patients have been followed up for years for any side effects of the procedure, and it has been confirmed that it does not have any serious side effects. So, how do you select patients for ImmuLIT procedure? That also I had briefly mentioned that we use certain specific immunological tests to find out the cause for patient, to select patient for ImmuLIT procedure, where we do tests like the cytokine estimation, TNF alpha, natural killer cells in the peripheral blood, if possible, natural killer cells in the endometrium. We do a lymphocyte antibody detection test or lymphocyte cross match to know about the blocking antibodies. We also do anti-thyroid antibodies, anti-TPO and anti-thyroglobulin antibodies, which have been associated with pregnancy loss or IVF failures, and which have been which can be corrected. The problem associated with antithyroid antibodies can be corrected by using the alloimmune treatment of ImmuLIT, because the blocking antibodies which are generated with ImmuLIT are structurally similar to these to antithyroid antibodies, and they competitively inhibit these antibodies, preventing their adverse effect on pregnancy. So these, if these things are tested, then and accordingly the procedure is done, then the chances of success are definitely good. As we have just told you that our recent internal audit showed a success rate of 82%, 82% in patients who had recurrent reproductive failure, where the success was measured as a take-home baby rate. So this is definitely a good treatment where it is really indicated, and which can be beneficial to many patients. So I will stop here. If you have any further queries, do write to us on the numbers which I have mentioned, and we will definitely get back to you directly by a direct message back. Okay, thank you for attending this presentation. See you next time in our ICPRM Friday Live. Thank you.